Okay, great. It looks like everyone can hear me and see my slide on the screen. Well, hello everyone. Welcome to today's webinar titled Reversing Preemption, a Colorado Case Study in our Healthy POS webinar series here at CounterTools. I will be your moderator for today. My name is Jackie Boards. I'm currently a project director over 3 states and the help desk manager here at CounterTools. Thank you all so much for being on this webinar, and we hope you will take away some helpful info as it relates to preemption and what you can do as a state or locality to help fight it. I want to first start with some webinar housekeeping. First, everyone is muted by default and can only be unmuted by me as the host. Secondly, there is a raise hand function that you will see. However, we will not be using this function during this webinar, so you will not need to click on this. And lastly, if you have any questions throughout the webinar, send those questions through the Q&A box or chat boxes. We will get to questions at the end of the webinar or follow up with you after if you have any follow-up questions after this webinar. So again, if you have any questions or having any issues with your tech or anything like that, just please drop those into the chat or Q&A boxes and we will get to those. Okay. Now, before I introduce the speakers for today, I wanted to start with a little background on us here at CounterTools. Well, we were founded in 2012 and are a nonprofit organization located in Carrboro, North Carolina, right next to the campus of UNC Chapel Hill, if any of you all are familiar with North Carolina. Here is a snapshot of the states and partners we have worked with during the past and the present across the United States. Some examples of states we have worked with or are currently working with include Maryland, Massachusetts, Wisconsin, Minnesota, Florida, Arizona, and many others. Our partners include organizations like the Campaign for Tobacco-Free Kids, the Truth Initiative, the Tobacco Control Legal Consortium, and others. Our mission is to empower communities to become healthier places through these 6 main areas as you see on the screen. First, we educate and coach individuals and groups through in-person trainings and webinars. We provide mission-driven technology tools that many of you all on the line are currently using, including the Store Audit Center, which is a data collection tool for doing store assessments, the Store Mapper, which is a visualization tool and gives a bird's eye view of the retailer landscape in many different states, such as where tobacco retailers are located and retailer density. And our newest tool is the Point of Sale Toolkit, or POST. It is a tool for managing retailer lists and doing assessment, education, and enforcement related data collection. We also convene thought leaders, experts, and practitioners when we can and attend conferences to talk with people as such. We support advocacy efforts such as providing recommendations or guidance for those working at the local level and taking public positions on issues and signing on to letters. We share research that we have done and research from others in our network through this webinar series that you all are on today and through our podcast, which is available on iTunes and other places, and we have different podcasts that we've done over time. So I would definitely recommend to check those out, and I can definitely give you more information on that if you would like. And lastly, we synthesize evidence and stories through creating communication materials such as fact sheets, infographics, and maps. Lastly, we have a helpful free online resource called countertobacco.org. Countertobacco.org is the first comprehensive resource for local, state, and federal organizations working to counteract tobacco product sales and marketing at the point of sale. The site offers evidence-based descriptions of the problem, policy solutions, advocacy materials, news updates, the latest research, youth engagement activities, and a media gallery exposing tobacco industry tactics at the point of sale. So please definitely check out countertobacco.org. It is exactly how it is spelled, countertobacco.org. And feel free to sign up for the newsletter on the website, and that will give you access to all these things I just mentioned on a monthly basis. So you can go on the website and also sign up for the newsletter to get all of this information every month. Okay, now let's get to the speakers for today. Well, first we have Mandy Ivanov. Mandy is a health promotion coordinator at Eagle County Public Health and Environment. In her position, she primarily addresses policies, systems change, and environmental strategies relevant to schools and youth to reduce inequities and improve health outcomes. Mandy administered the State Tobacco Education and Prevention Program for Eagle, Garfield, and Pitkin counties in Colorado for 4 years and continues to lead tobacco control efforts in Eagle County. Then we have Jill Bednarik. Jill is the state and community's tobacco policy manager at the Colorado Department of Public Health and Environment, where she directs the youth tobacco prevention and secondhand smoke initiatives. She has worked in tobacco control since 2005 and has contributed to policy efforts to reduce exposure to secondhand smoke among multi-unit housing residents, workers, and the public, and to reducing illegal sales of tobacco to minors. She created a youth advisory committee to the State Department in Health that provided a youth voice and advised the department in a range of topics, including youth sexual health, alcohol and tobacco, and other drug prevention and health promotion. She received her master's degree in social work from the University of Denver. She has served as a member of the board of directors for several nonprofit organizations and is the proud mother to 3 young adults ages 22, 22, and 18. Now, Jody Radke. Jody is a regional advocacy director for the Campaign for Tobacco-Free Kids. Jody manages tobacco control policy for 11 states, promoting and supporting legislation that prevents kids from starting tobacco use and assisting adults that wish to quit. Prior to Jody's work with CFTFK, she was a regional prevention specialist working for 6 years statewide in Colorado with SAMHSA grantees. She completed a fellowship with the Robert Wood Johnson Foundation, working nationally and internationally on tobacco control. She is an alumni of the AmeriCorps Vista program and a former candidate for the State House of Representatives within the state of Colorado. So those are your speakers for today, and I will actually hand it off to the first speaker, which will be Jill.
Thank you, Jackie, and thank you all for this opportunity to tell a bit of the Colorado experience in working to remove barriers to point-of-sale strategies. Our talk is going to be about our efforts to address youth access through stronger laws directed at retailers, specifically licensing and active enforcement of retailer sales. Our story has been a long and winding adventure, sort of as this photo depicts. No, that's not any of us really, but you get the idea. I'm going to provide some background information and the context for the presentation, as well as share the State Health Department role and perspective. And you can go to the next slide. I'm going to start by explaining the preemption that we have in Colorado on local youth access policies. It's a little bit different from explicit preemption, and as such, our state usually is not identified on many of the lists of states with preemption on local youth access strategies. Our law requires a fiscal penalty to communities rather than an outright preemption, but it has the same effect as an explicit preemption and has discouraged local communities from working to protect their youth from harmful effects of easy access to tobacco and predatory marketing practices from the industry. And it started approximately 40 years ago. The tobacco industry struck a deal with the Colorado General Assembly and local jurisdictions. At that time, the state implemented a 20-cent tax on a pack of cigarettes. This grand deal was that a portion of that tax that the state collected would then be redistributed back to the local towns, cities, and counties, as long as they did not impose a fee, a license, on the business of selling cigarettes, or a tax on cigarettes. I'm going to refer to this fiscal penalty provision in state law as a preemption during this presentation. And you're going to later hear about a bill that proposes to amend the tax statutes to remove this penalty to local communities for implementing best practices in tobacco control. That's on the screen here is a shot from the statute that talks about, has that language there that prohibited from imposing fees, licenses, or taxes in the middle of that, and the actual reference to our law. Okay, the next slide. So our work to address preemption began in about 2010. Jody and I, we were just talking again about it's hard to decide where the story starts, but we really think that our work began in earnest in 2010 when our tobacco control program convened a large group of stakeholders, and here's an image of the stakeholder final report. And it included state and local elected officials, tobacco control advocacy organizations, other state agencies, youth representatives, and researchers in tobacco control from the University of Colorado. Stephanie Walton, who's no longer with our department, managed the process. And it took about a year to convene the group, develop the recommendations, and produce the report. So the purpose of the group was to review the data in Colorado. We knew we were an early test market for non-traditional tobacco and nicotine products, dissolvables, and some other items like that, to review the published literature and proven strategies, and to examine our statutes and identify gaps for where there could be opportunity for change. We remain to be one of the few states with no licensing and then this local exemption of best practices. So then use that information to rate strategies and make recommendations. So it was through this process that preemption of local tobacco retail licensing rose to the forefront of the tobacco policy agenda. Next slide. The top 4 recommendations from that stakeholder group are listed here: get a state license, increase penalties for violations to sales to minors, update tobacco-free schools law, and then what I have here in the red font really talks about this removing the preemption. And so next slide. So then once this was identified as a top priority, then the health department could and did work with the legislature to promote tobacco control best practices, and was successful in updating the tobacco-free schools law, helped to get Colorado to be one of the first states in the nation to prohibit the sale of electronic nicotine smoking devices to minors. We worked on a variety of other legislative efforts to implement the recommendations from the stakeholder group. Some of those, not all of them, were successful. Then our program also worked to build relationships with a variety of different entities so that we could educate them about the priorities recommended in the group, the stakeholder recommendation group. And then we worked to structure our grant program. And so the money that we were putting out the door from our tobacco tax that funds our program, and we fund most, all of the local health departments around the state, we really worked to look at how we could structure the grant program so that it would help build the conditions for local change. We did also require that our grantees that wanted to work in the youth access work, we told them to work on passing local non-cigarette tobacco retail licenses. So that would be a way to not subject their community to losing the fiscal share back, but would still get as close as we could to the best practices. There was plenty of debate about whether doing something part way, a non-cigarette tobacco retail license, would still have a public health benefit. And I want to say that our work with counter tools at the time and the store scans that we did helped us determine that most retailers who were selling cigars, other tobacco products, and many nicotine products were also selling cigarettes. So we did see that it would be beneficial to implement a non-cigarette tobacco retail license. And then we created a variety of different media materials, policy resources to help grantees do education in the local community about the need for licensing and help to promote best practices or near best practices given this preemption. Next slide. So I have a couple of examples of the type of materials we created. Here's one that shows why we need stricter enforcement and licensing efforts. Then another, if we go to the next slide, is a snapshot of some of the policy resources that had what we were putting in as our model policy standards for non-cigarette tobacco retail licenses. We had how to do 21 and licensing together. And then this little chart here shows a community there, the compliance data with a non-cigarette retail license. We saw that they had more, they were more likely, they were doing more enforcement than communities without a license, or that those retailers were experiencing more more compliance checks, and they had lower violation rates than communities without a license. And we were able to see this shift from a fairly high or very low, I'll say, 56% compliance rate to 100% compliance rate after just a little bit of time with that license. And overall, our licensed communities saw a 76% reduction in violation. We also worked to make sure, you can go to the next slide, that our leadership, both within the health department and above the health department, were aware of the data trends, evidence-based interventions, and obstacles to addressing public health concerns. This is a photo of Governor Hickenlooper. His term ended in January, and in November, he issued a proclamation, Vape Free November, and signed an executive order directing the department to work with other state agencies to address the high rates of youth vaping. Here he is signing that executive order, and we've got our executive director and chief medical officer, as well as some staff from Children's Hospital that were part of the big event. So my point here is that it was really helpful to keep the department leadership well informed of a variety of things that were happening in youth tobacco use and nicotine product use, and to help call attention to that and to take those opportunities to highlight the need for Colorado communities and the state to implement proven practices. And next slide. So with all of these efforts that I've described, we now have 12 local communities that have adopted an ordinance to require licensing of tobacco retailers. 8 of those are non-cigarette, but lately we've been moving towards licensing all tobacco products, even with the preemption in place. And that's where the story starts to get exciting, and I'll turn it to Mandy in just a second here, because her communities are the ones that have really taken the lead in this effort. I do have the 3 also got voter approval for a tobacco tax. I have that in red because I just wanted to be very clear that our grantees do not use any of the grant dollars or staff time to work on a tax initiative. But those local communities, once they understood what was going on and were educated about the needs and the best practices, then went above and beyond and did these things themselves with Jody's help. So all of these grantees or all of these communities that have passed licensing, they have an annual non-transferable license. They meet all the recommended components of a strong retail license. The tobacco industry and their surrogates have worked really hard to try to stop these efforts numerous times and expand preemption at the state level. Next slide is just a quick snapshot of where all of those communities that have licenses in Colorado, where they're located. And then my last slide is just some lessons that we've learned from the state perspective. Establish solid partnerships with multiple organizations. Make sure they are well versed in what are the proven strategies and what are the barriers in our state to get there, and raise awareness about the impact of preemption. Help keep a focus on that. I think there were numerous times that we thought, well, there's really just not much we can do about this, and I think it's been helpful that we have really tried to keep a lot of attention on the problem from the preemption. And then I encourage you to seek solutions and adapt your approach to best align with proven strategies. You know, like I said, our non-cigarette tobacco retail license we thought is kind of an odd thing, but we really, our intent there was to align our efforts as close as we could with proven practices. And then I also would say, be prepared for a long investment of time and energy. Don't give up. Do expect that the industry's main strategy will be to expand preemption, to keep that preemption in place, that this is a very effective tool for them, and that's where they're going to put their time and energy. And then with that, I have a slide here with my contact information where you can contact me if you need any more information from the state perspective, and then I'm going to turn it to Mandy. Thank you.
Hello, my name is Mandy Ivanoff, and I'm a health promotion coordinator for Eagle County Public Health and Environment, which is in Eagle, Colorado. Again, as Jill said, really appreciate this opportunity to share the story of what's been happening in about the last 1.5 to 2 years here in my region. Next slide. So in terms of where we are, Jill shared a map of Colorado. Here it is again, our lovely square. Within that square, about 2 hours west of Denver on Interstate 70 is where our region is in the Central Mountains. We are in a part of Colorado that is sometimes referred to as the rural resort region. Ski resorts of Aspen and Vail kind of hold down the corners of that square, and until August of 2018, we had only one local public health person to cover a 3-county region. So I was heavily involved in the policy work during this time. The blue stars on the inset map indicate where we've had local tobacco control policies enacted since January 1st of 2018. The bottom center star is Aspen, and then the momentum traveled up that highway, the yellow line there, to Basalt. And then the third star up in the upper right-hand corner is our most recent success in the town of Avon, which is just 6 miles west of Vail. Next slide. So here's a timeline just to give a snapshot of how this effort has moved along. Aspen passed their passed their ordinance in June of 2017 to take effect on January 1st of 2018. And it was shortly after that Basalt passed March 2018, went into effect July of last year, and then Avon was in process at that point, passed in August, and took effect January of this year. So I was quite busy during that time, as you can see. The discussions did get quicker in terms of kind of going through the steps, the hearings and whatnot with the councils as the momentum built. And I'll go into a little bit around that in terms of how this took on a level of urgency. Next slide. So in Aspen, we had a local champion there, Dr. Kim Levin, who's the county medical director and local emergency room doctor, who had read an article on Tobacco 21, and she became very passionate about this and approached city council. She connected quickly with the Preventing Tobacco Addiction Foundation, or the National T21 movement, and had some great support from their regional director for this effort. And then I was also looped in as local public health to understand the importance of licensing for raising the minimum legal sales age, and also not only the importance, but the ramifications in terms of including cigarettes in the comprehensive tobacco retail license, in terms of losing the portion, Aspen's portion of the cigarette tax shareback that Jill mentioned. So we worked together with Aspen, with the council. Aspen has always had a reputation of being kind of unique. So they were not concerned with their tax revenue loss. They have quite a healthy tax revenue base. and losing that share back was not an issue for them. So this was a big win in terms of seeing that go forward. And they also wanted to ensure that cigarettes were included in the license, and really set themselves up for success. The next town to take up this charge was Basalt, which is about 20 miles north of Aspen, and it's really the next next incorporated municipality going north from Aspen. And the local champion there was a council member, Bernie Grauer, who had admired the work that was going on in Aspen and decided that their town of 7,000 some people should make a similar effort. And so we started at the end of 2017 with the ordinance work. The council passed the effort in March of 2018. There was some concern in Basalt over including cigarettes in the license. But we did have, again, we had great support from the National T21 regional director and from some of our other local champions in making the case for including cigarettes. And the council decided to pass a comprehensive license for Basalt as well. Because they were concerned with their shareback loss, were interested in pursuing a tax question as well for the ballot, and so connected them with Jody at Campaign for Tobacco-Free Kids. Much as we had in Aspen, handed that work off to her and her team, and they passed that question with overwhelming support, and to date have seen success in their efforts. Another piece that came up after Basalt passed their ordinance was this feeling that momentum was growing and that it would continue moving north along the highway, arriving at Glenwood Springs, which is one of our largest metro areas west of Denver. And it never seemed to. It kind of stalled out. There's quite a bit of unincorporated county land in between, but unincorporated land that has population density to it. And because those areas could not kind of carry along the effort, we felt like we were losing some momentum there. In May of last year, an Avon Town Council member, next slide. In May of last year, an Avon Town Council member, Scott Prince, reached out to me, and now the issue turned to the vaping epidemic. So, as some of you may be aware, Colorado has the highest high school age use rate in the nation for vape products. And our rural resort region actually uses at a higher rate than our state average. And so this issue is very complex, and it's also very concerning for us in our communities. And our champion in Avon saw local ordinance as perhaps a way to help address this problem in terms of access. Because Scott is the parent of a teen, there was some urgency in his request, and it also fuels his passion for the work, which is a huge asset in getting this message across to other council members and to the public. So we worked with Avon Town Council. We were able to gather a group of youth who were wanting to educate on the vaping scene and really urge the town to take some action. So they presented on how a comprehensive tobacco retail license and a minimum legal sales age increase would benefit young people in the community and the impact that would have. And the youth were also able to highlight really why the license had to include all tobacco products. So the shareback was a bit debated in Avon. They are kind of in the same boat as Aspen in terms of having a pretty healthy tax revenue base as it is. And so they did decide, they voted to include cigarettes and go for a comprehensive tobacco retail license, despite losing their shareback. And then they also decided to put a tax question on the ballot, and again, worked with our national partner to hammer out the details of that. That was passed in August last year and went into effect January 1st of this year. One of the big things that came up in Avon more so than Basalt and Aspen was the concern over neighboring populated areas outside of town limits. Avon is located between two pretty high population areas of Eaglevale to the east and Edwards to the west. Next slide. Which brings us to this kind of patchwork challenge. As Jill explained earlier, in Colorado, the state preemption through the fiscal penalty provision prohibits local communities from adopting tobacco control policies that meet their needs. And this is particularly the case with counties. And it creates loopholes in youth access, confusion for adult consumers, and frustration for retailers. In the case of Basalt, the unincorporated area of Elgibel is a literal walk across the street. And so we heard from local tobacco retailers in Basalt that they witnessed their patrons do exactly this in August when the tax went into effect, and their patrons learned that they could go across to the liquor store and purchase their tobacco products at a significantly lower price. And so frustrated retailers is not an outcome we want from passing these ordinances, because it makes it significantly more challenging when we move to a neighboring community to do this work. So we really wanted to address that. And then again in Avon, we heard repeatedly the concern that youth who reside in Avon attend high school and middle school in the unincorporated adjacent areas. And so they can still easily access tobacco products, whether it's high school youth stopping off on their way to the school to purchase at the gas station, or middle schoolers getting them from fellow middle schoolers who live in Eaglevale and don't live in Avon and have older siblings who can access for them, really kind of causing a inefficiency in terms of shutting off the access for our youth. Next slide, please. So what we learned was that for local policymakers, the use of tobacco products was really the hook to open discussions around the comprehensive tobacco retail licensing, and having youth involved in the education piece was critical in terms of conveying the importance of really including all tobacco products, having them, really consider what the value was for them to include cigarettes and forego their portion of the shareback, in terms of the impact on our young people's health that it would have. We often had to kind of divert our messaging from local policymakers that challenge the inability of counties to act and implement similar ordinances. This came up as a common challenge. Why can't the county do something? What does the county's plan to do? And we really flipped that a bit and focused on building momentum of local control so that we could demonstrate its impact and eventually address the inability of counties to act. And all the way along, just to echo what Jill shared earlier, the partnerships we had were key in really getting this work done. And American Cancer, Tobacco Free Kids, American Lung, Preventing Tobacco Addiction Foundation, they were all involved and really helped with the guidance and support that we needed. And the last slide is, yes, my name and information. My apologies, I don't have my contact information up there, but I'm sure Jackie will share that out.
Yes, yes, I definitely can. Okay. Jody, are you there? You are up next.
I am. And if you wanna, great, okay. Welcome everybody. My name is Jody Radke. I'm the Regional Director with the Campaign for Tobacco-Free Kids, and my region includes Colorado, and I happen to also be based in Colorado, for those who may not be aware of that. First, I just wanted to share a quick thank you to my colleagues, Mandy and Jill, for such an exceptional overview of our work in Colorado, and truly for their personal and professional investment in this issue over a very extended period of time. This has not been an easy lift, and so much appreciation for their work. We at the Campaign for Tobacco-Free Kids are really honored to have played a role in the storyline that you're about to hear. Next slide. I wanted to begin by sharing the composition of Colorado's state coalition with everyone that's joining today. You'll recognize many of the organizations on this slide, which contain both national and state-specific partners. All of these partner organizations have played a critical role in this session and previous sessions in removing the preemption that we're discussing here today. I'd also like to note that some of our listed members on our coalition are non-voting members. And this is an important distinction because you'll note a couple of these, the Colorado Department of Health and Environment, the Colorado School of Public Health, they are funded by our tax dollars here in the state of Colorado, so they're not involved or engaged in our advocacy efforts, but they are part of our Colorado Tobacco-Free Alliance. Next slide. I wanted to briefly orient you to the Alliance's mission, and most specifically the way we've opted to prioritize our approach to our work. It's one that's coordinated with both our local and state partners, as you've heard from my colleagues, and that communication truly flows in both directions. You'll note our policy objectives, which are also included on the slide, and they are not listed in any particular order, but what I would like to draw your attention to and highlight is the one that appears at the bottom, reducing youth use and access to tobacco, which is really the center point for this preemption work that we're discussing here today, as our preemption specifically relates to youth access issues. Next slide. Our Alliance is committed to the values listed here. We recognize that local and state public health efforts are the foundation of what we do at the state level and truly what translates to our outcomes at the state capitol. This is legislation in our state statutes that's been there since the early 70s. And so the work at the local and state level have truly been the compass for our work. Next slide. Okay, now I'm going to walk through some of Colorado's legislative history. You heard Jill mention earlier we weren't sure where the starting point really began. Some of those lines get to be blurred over time, as I think most of you may relate to. So I'm going to rewind our story 6 years back, the 2013 political landscape. And as you see here, we have a Democratic trifecta. So we have a Democratic governor, the Democrats control the House, and the Democrats very narrowly control the Senate and state during this year by a 1-seat margin, very narrow. In Jill's earlier slide, she'd mentioned some of the successes to this point that we had had at the local level. Between 2011 and 2012, we had 5 cities that had passed local policy that required tobacco retail licensure. Concurrently at this time, at the national level, we had also just started very early conversations and policy work around raising the age of sale from 18 to 21. Also during this time, if some of you remember the news, Colorado was one of the first states to approve the legalization of recreational marijuana with Amendment 64. So given the Democratic trifecta, our work on youth access on tobacco retail licensure to this point, the national conversation around age of sale, the polling data, we had determined as an alliance that we, not afraid of being the first with legalizing recreational marijuana, that we would attempt legislatively in the following year in 2014 to introduce age of sale legislation. Next slide. So here you see the introduction of House Bill 1263. This was our first attempt at elevating the issue around youth access, in addition to the work we had done locally on licensure. So keep in mind during this time, we've had a lot of activity as of late, but this was pre-Institute of Medicine report in terms of the timing. It was before the body of evidence had really been introduced to the public. And so we knew in advance taking this policy on would be a very heavy lift for Colorado, but felt given the work that had been done at the local level to this point, it was worth beginning the conversation around youth access in a more comprehensive way. And it really provided us the backdrop to discuss retail licensure at the state level, age of sale, the enforcement, and what that should look like, amongst other policies that effectively reduce youth use. Next slide. So here you'll see the trajectory of that bill from 2014. It passed our first committee, was referred to House Finance, where it was voted down by 1 vote, which was quite disappointing. One thing I'll note in the Finance Committee, I just ask that you keep these 2 names in the back of your head, because you're going to hear them in future slides. We had two legislators on that committee, Representative Kevin Priola, Republican, and Representative Casey Becker, a Democrat, who at that point in time became acclimated to our issue of tobacco control in a way they hadn't before. And this was a committee that had a very heavily debated dialogue around age of sale, age of majority laws in Colorado, and the philosophy behind, an approach behind tobacco control work and youth access. So keep these names kind of front and center as I move to my next slide. Okay, so 2014, we did not see success with that bill, and the elections changed our landscape moving into the next legislative session. So here you see the House is still retained by the Democrats, but in this, the last elections, the Senate was actually, the Democrats no longer retained control of the Senate and actually yielded that control to the Republicans, who now, the Republicans had a 1-seat Senate majority. So that was a pretty notable shift in our state and changed that power dynamic. And if you recall from then my earlier slides, we left off from introducing the age of sale, losing by 1 vote, and then created a lot of momentum. In addition to that time, we had also had another community that passed tobacco retail licensure. So we continued to build our story with our elected officials at the state level around what was happening at the local level and continuing that momentum. But as an alliance in this year, instead of revisiting our policy to raise the age of sale, we instead decided to look at the obstacles that existed for our local work and wanted to really remove those in our preemptive language so we could allow our local communities to do more than what they were currently able to do. Next slide. So looking at removing preemption, as I mentioned the 2 names before, we worked closely with a Republican and a Democrat, the 2 names I mentioned earlier, that sat on the Finance Committee. They were both very impressed with the quality of the presentation of the bill when we looked at raising the age of sale, the knowledge of our advocates, and the passion for the issue. And they really developed a strong belief in what we were working on at that time. And they agreed to come on as bipartisan prime co-sponsors to restore local authority and remove preemption. And so that story began in 2015. Next slide. So here you see the trajectory of that bill. In 2015, our preemptive work passed out of its first and second committee in the House. It passed the House floor, was assigned to its committee of origin in the Senate, where it then died. We were very disappointed. We had thought we had enough momentum to get that over the finish line, but that 1-seat Senate majority on the Republican side really wasn't a benefit to us. So we were disappointed, but we were not defeated. And really, as an alliance, we went back to the drawing board to discuss then what would come next. Next slide. And what came next wasn't a bill that we introduced, but rather a response from the tobacco industry and the Petroleum Retailers Association. So in the time frame that we've been working the last couple sessions, and in response to our building partnerships, building momentum, and just narrowly being defeated on some of these legislation pieces we were putting forward, the response to that was then to find an ally on the House side and to introduce the bill you see here, which is House Bill 1370. This was referred to as the Tobacco Registry Bill, and it was really the industry's response for what we consider not licensing tobacco in an effective or comprehensive way. It included a lot of things we did not like, including additional attempts to limit the work of local and state public health, accused them in that dialogue of lobbying, expanded preemption in that bill. It had a number of things that the world of public health and our partners were strongly opposed to. Next slide. Thankfully, that bill was promptly defeated in its first committee hearing, and we lived to see another day and really were able to minimize any further damage that might come from that bill in terms of impacting or inhibiting any future work at the local level. Next slide. So coming off of that session, the elections of 2016 led us into the session for 2017. And what you see here is some significant or notable changes, not in terms of numbers, but you'll see the Democrats again holding control of the House, the Republicans retaining their control of the Senate, but the Democrats losing one of their members by changing party affiliation to become an independent. So that definitely was not a landscape that worked well for us or in our favor when we started to have some of these early conversations around policy to pursue next. Next slide. So 2017, the Alliance decided to take a bit of a break and to do more work at the local level and support that work to continue to build the story that we could then tell the legislators around what was happening at the local level to create that momentum. But we definitely didn't feel in that year we had the support to move any of our larger policy pieces forward. Next slide. But in 2018, we then were put in the position of playing defense. The tobacco industry, again, seeing what we were able to accomplish locally because the local efforts continued, as I just mentioned, through 2017, switched from the House to the other chambers, so switched their focus to the Senate, where they had that one-seat Senate majority on the Republican side where they knew their groundswell lied, and they knew they had a Democratic member that had shifted over to become an independent. So they did find an ally in the Senate to introduce what you see here, which is Senate Bill 139. This was far more restrictive than the earlier bill we had seen introduced. The one I referred to as the registry bill had far more gravity than the previous version that it had been introduced and was very alarming to the public health partners and organizations across the state and locally. Next slide. Here you see the outcome of this bill. It was killed in its first committee, so did not pass, thankfully. What I will say here is this bill brought multiple partners together in a way that we hadn't really seen in a number of years. But due to its extensive restrictions, not only did our partners come together in a very meaningful way, but our Republicans and our Democrats worked collectively and together, recognizing the impacts of these limitations on their districts to defeat this legislation. And it was handily defeated. So this was a strong public statement against the industry's attempts, but it also was a huge victory for the Alliance in 2018. Next slide. So 2018 elections take us into the session we're currently in. So here you see we return in Colorado to the trifecta. Colorado voters reelected a Democratic governor. The Democrats not only retain control of the House, but improved their margins significantly and actually took control back of the Senate, but not took it back by that one-seat margin that had been kind of this tennis match between the two parties over the last several sessions, but actually gained several seats. So put some of these policy issues in a very different landscape and light. Next slide. We also had the added benefit this year, just to lay some additional context. We all know about the vaping epidemic that's happening across the country, but as Mandy mentioned, Colorado happens to lead the nation in vaping use across the country. That's bad, of course, but in the end, it really does prove to be a great talking point to engage our elected officials, who are now feeling very motivated to respond to this epidemic that's been happening across our state and really want to do something. So in addition to the change in the political landscape and this vaping story, and as you can see the numbers here, as Mandy mentioned, particularly in the area that she covers, we are in the mid-30th percentile, well above the national rates in this space. So in 2019, and Mandy laid the groundwork for what's happened between then and now, we had a much greater story to tell. These incredible successes that both pointed out earlier with a number of new cities that had passed broader, more comprehensive legislation, and that list was only continuing to grow. Next slide. So here in 2019, this session, we come full circle. The two legislators that I had been mentioning in previous slides, former Representative Casey Becker, who carried our initial preemption bill back in 2015, is now Speaker of the House Becker. So she is in a position of leadership and extraordinarily supportive of this issue. Representative Priola, who carried that bill with Representative Becker, Republican, is now Senator Priola. Senator Priola is also notably a father of 4, who has a son who is one of those statistics you saw in that earlier slide, who is part of the vaping epidemic. So very passionate about this issue. So our work in those early years, laborious, most definitely, and at times disappointing and helpless, notably at times, really led us to this session that we're talking about right now, which is a window of opportunity. Honestly, we could never have predicted, but one that was built on a foundation of trust, partnership, communication, and credibility. And just a quick summary of 1033 and what it does, it has effectively removed the preemption for our cities around license abilities, assessing fees, and taxation. And it also expanded, Mandy mentioned counties have been struggling because they haven't had explicit statute authority to pass similar pieces of legislation and are encountering these issues cross-border. This bill also expands that authority now to include in state statute our county's ability to do the same, in addition to raising the sale, which wasn't included in our previous state statute. So it does a number of things that we love. Next slide. Just want to give you a quick snapshot or overview of our opposing organizations on this legislation. Pretty familiar names, I'm guessing, to many of you on the phone, but those were our main opposers. This was an excerpt from a letter and then emails that were sent to our House committee members and then to the House floor. You'll see their leading arguments against this on the bottom. Not unfamiliar, I think, to most of us, but these were the 3 messages that they were fairly unified on and kept throughout our work on this legislation. Next slide. Our proponent messaging, this slide has a lot of information on it, so I just wanted to highlight 3 things for you to take a look at. First, our bill sponsors. You see Kevin Priola's name again there, our Republican former House sponsor, now Senate sponsor. But the 2 names that are most notable, Chris Kennedy and Rhonda Fields, they are both in members of leadership. And so this bill in 2019 was bookended by leadership in both the House and the Senate, and then Representative Carrie Tipper. This was her very first bill as a legislator, so really want to give her massive applause for taking on such a controversial issue, such a layered and difficult issue in her first session and her first bill. Our leading points were really around the organizations that supported, names they knew and trusted, most notably CML, Colorado Municipal League, and CCI, Colorado Counties Incorporated, 2 very influential organizations at the Capitol who had a very vested interest in this. Our leading message, what I'll share with you, is that our message with legislators was our local communities know their communities best. And at a time that vaping use is an epidemic across our state, we should not be limiting authority, but if anything, we should be expanding it. And we need to really ensure that our communities have the tools in their tool chest to respond to the epidemic that's happening across the state, and really informing them that they currently didn't have that. Next slide. Just a quick picture of one of our 4 public health heroes. Chris Kennedy, as I mentioned, is one of our bill sponsors and in leadership. Just a couple quick mentions here in this media coverage. He talks about how communities have been stripped of their local power and refers to this as a power play by the tobacco companies in the early 70s, protecting their interests. Great media quotes, very invested legislators that we couldn't have been more thankful for, that really took the time to understand this issue inside and outside, and immense gratitude to them. Next slide. I'm just including this in the slide. I won't go over a lot of this. This is only just a link to some of the coverage that happened on this issue across the state, where they talk about Colorado towns getting fed up waiting for the state. Great coverage, great story that gives a really nice overview of the complexity of this issue and what we were doing at the state capitol and what was happening at the local level. So I wanted to include that for reference. Next slide. These are quick slides. Just want to say we win when we work in partnership together. We couldn't have done this without Mandy and Jill's groups on the ground, and so very appreciative of that. Next slide. Just a fun piece of word art, because I think we can all relate to this, but I think the words that stand out for me along this roadmap are patience, tolerance, and perseverance, and certainly all of these words included here are necessary and needed. Next slide. And just to say, preemption can feel pretty impossible at times, and we certainly thought it was too in Colorado. I rewound 5 to 6 years for this to tell this story, but honestly, it's been going on for close to a decade. So what we thought was really impossible here in the state became possible because all of the partners listed here played a role in making that happen. This was not an easy lift by any definition. Next slide. And my closing here, just some lessons that we learned. We started with a democratic trifecta. We ended there, but obviously that doesn't ensure success on these issues. Relationships and partnerships do. We never could have predicted the timing on this. Our work last year on this issue began in June. Colorado's session ends in May. So we began immediately after our last session ended. So really the timing seems ideal, but you never know when those windows open up. And then I'll just close with my last comment. Local work in whatever form. I know there's a number of states on the webinar that are fully preempted. So if that's resolutions of support, if it's ordinance, if that work is allowed, local work is what drives us. It is the compass for what we do in the world of advocacy, and it truly is critical in the outcome. And then next slide, Jackie, is just my contact information. Thank you, everybody.
Thank you, Jill, Mandy, and Jody for speaking about Colorado's experience with preemption. We'll pause here for any questions people may have. And I see some questions coming in. So we'll take those questions and we will stay on the line to answer some of your questions. Okay, so the first question I see is, for all three speakers, in your opinion, do you think it would have been more difficult to make this degree of progress had Colorado had a statewide tobacco retail license? In comparison to states that do have a statewide TRL, but are striving to get local TRLs adopted with some of these components, ends, T21, no sales within a certain proximity of schools, etc. So in your opinion, do you think it would have been more difficult to make this degree of progress had Colorado had a statewide TRL?
So Brittany, that's a good question. This is Jill, and I got to think about that a little bit. As Jody pointed out, the industry has tried anytime, repeatedly to say, hey, the solution is let's do a state licensing. And then they quickly, rather than describing a license system, they describe a registry. Very weak, very little penalties for violators, and as Jody pointed out, we've been able to defeat that. I don't know. I think that really the answer is the industry is going to try to make sure to keep power focused at the state level for them and keep it as weak as possible. And I think you can continue to do like the resolutions and the things that Jody was talking about, have your boards of health do efforts, but really focus on these local groups can, if they have the power, they can keep moving forward.
Anything else from the other two speakers on this?
I would say the one thing I would add, this is Jody, is in relationship to the licensure, a number of the licenses we see at the state level, I think could be strengthened and could be improved. And so I think in looking at licensure, Colorado, I think legislative elected officials are a little surprised and fairly shocked, some of them, that we don't have licensure. So I think that is a nice invitation to discuss youth access issues further. But I think also if you're in a state where your licensure system that can be strengthened and maybe weaker than what you'd like, I think that also provides the same opportunity and background that we did here.
Okay, great. And we have one last question that came in. So how do we find a balance between keeping youth from vaping, yet keep it available to people who are using vaping instead of smoking?
So I'll start again. This is Jill. Thank you for that question, Stuart. So the first thing that we can say, and this is from looking at our data here in Colorado really closely, and the situation right now is so far out of balance, it's hard to even talk about these two in the same context. we have the number of youth and the percent of kids who are vaping, as well as when we start looking at adults who are vaping, even within that context, the majority are still, one, either young adults who are never smokers that are being introduced to a nicotine addiction, or two, they are people who are doing both, which is not safe. So we are so far out of balance, it's hard to consider these in the same policy discussion. So we really need to do much, much more to reduce youth access and youth appeal, including going with the licensing efforts and I think we ought to start increasing the age to 21, and we ought to be looking at flavor bans, and then also when we look at the latest study that was published that talked about some benefit, we have to keep in mind that study showed the benefit was 2 adults who were using vaping in a, really more of a clinical or like a quit line kind of a context where they were getting coaching, they were really working on quitting, not just what we see in Colorado, just kind of open, almost recreational use of vaping, and easy access to that. That's not the setting or the situation where the products are helpful to get people off of smoking.
Thank you. Well, yeah, go ahead.
Oh, this is Mandy. I was just going to add too, just with working locally and the discussions we had, I can't recall there ever being a concern raised that the ordinances the towns were pursuing were going to hinder adult access to vape products if they wanted it. It's, with the age and with acknowledging that our local retailers are selling to kids under 18 as it is, I think just tightening those 2 aspects, it never raised a concern around the adult vaping issue, which is great because, to Jill's point, they're kind of 2 separate buckets. And so with the focus on youth, that's really where our effort stayed.
Great. Well, thank you, Jill, Mandy, and Jody, again for being speakers on this webinar. To those on the line, we thank you for attending this webinar, and we hope you took away some helpful information and that will be insightful for your efforts. As a last note, everyone on this webinar will be getting a follow-up email from me with some materials from this webinar, such as the PowerPoint, and an evaluation survey after this webinar. So we want to see how the webinar was. So look out for this email from me. And I hope everyone has a wonderful rest of their day. And we actually will just stay on the line for another minute or 2 just in case anyone has any last-minute questions. But thank you again and have a wonderful day.